Hi everyone, my name is Emanuelle Diaz and this is my presentation for our qualitative methods class. So the title of my project is actually a quote from one of my participants, which is, young people in general are going to want to do what they want to do. COVID-19 communication experiences and future intervention preferences. So this was a topic of interest of mine just because of my own experiences during the pandemic. I was seeing a lot of false information going around and I was just interested in what folks are doing to access and understand the information that they have. So to give you all a little background, health communication is a key factor in high quality healthcare. So as we have seen this year, there is a need for innovative health communication during the COVID-19 pandemic, especially for young adults, so those between the ages of 18 and 29 years old. There is a gap in literature for this topic. There has been more out as of late, but there is some exploring the role of social media and how social media really affects how young people access information. So the overall research objective for this project was to, one, explore the perceptions and experiences that young adults between the ages of 18 and 29 have on accessing, understanding, appraising, and applying COVID-19 health information. And we also want to look at the preferences regarding future COVID-19 health communication. So to recruit participants for this study, I just did social media blasts on groups and pages to get 3 people to talk to me. So this is just an example of one of the flyers that I had. So I actually used a theoretically based interview guide. So I was really interested in the idea of health communication, but health communication is very broad, right? Like, what does that even mean? So I decided to use the integrated model of health literacy, which is it's an overall model for looking at 4 components of health literacy. So we have accessing, understanding, appraising, and applying health information. So access refers to the ability to seek, find, and obtain health information. Understand applies to the ability to comprehend the health information that is accessed. Appraising is the ability to interpret, filter, judge, and evaluate the health information that is accessed. And then apply is the ability to communicate and use the information to maintain decisions to improve health. So the overall goal of this theoretical model is to access 3 domains of healthcare, which is healthcare, disease prevention, and health promotion. So I was interested in looking at how folks think about these 4 components, specifically with regard to COVID-19 health information. So I had 3 participants. I had a nanny and a student age 27, and she identifies as white or Caucasian. I had a research coordinator that works at a children's hospital that's 25 years old and is of mixed race, so black and white. And then I also had a program assistant that works at a medical program, which is 25, and she is also of mixed race. So I had 5 general themes in my data. So the first theme that I looked at was the consistency of communication. So something that a lot of folks brought up was that there was a lot of inconsistency between sources. So maybe they would go to CDC and then they would go to their local health department and there would be different information about mask wearing or about case numbers, whatever it may be. So a good quote that represents this is, so the biggest thing is consistency. When it comes to COVID-19, it really has got to be from top down, because I was locked down here in Ohio where the cases were not good, but at the same time Florida was running rampant. I was in lockdown and the bars in Florida were open. So as far as like nationwide, this is where I say it needs to come from top down, as if leadership at the top needs to give out nationwide mask mandates, giving nationwide expectations for bars, clubs being out. Then as far as nationwide transmission, that would automatically have been lessened because people are still flying. So this was just one of the main themes that was expressed, that there was inconsistency, right? Different things were being communicated and nothing was clear. The next theme that I looked at was the impact of personal experiences on decision making. So this was looking at how someone's personal experiences with the pandemic impact their decisions regarding behaviors around COVID-19. So one quote I had, as you can see, the first quote, the participant expressed that she lives alone. So this affects how she goes about and does her groceries and goes to work. And then the second quote, the participant expresses that she personally doesn't know anybody who has died, so that skews her opinion. And this obviously affects her decision making and how she lives her life. The third theme that I found was that I found that participants were often questioning the reputation of a source. So this refers to when a participant is gauging or questioning whether or not a source is reputable. So this affects their overall health literacy, right? So it affects how they understand, apply, and appraise the found health information. So I have a couple example quotes here. So the first one, I was sent multiple links, and when I read them, I was questioning where did they get this information from? And it was always just like not accurate. So when like people are making stuff up, I don't know how they made it up. And the second quote here on this page expresses how social media is not a reputable source. So anyone can post anything. So I found this one particularly interesting just to gauge, what folks were thinking is reputable and what was not. And so, so this was the third theme of the interviews. So the fourth theme that I found kind of relates closely with the trans-theoretical model, construct of decisional balance. So I decided to go along with the same name. So decisional balance refers to decision making around the pros and cons related to the COVID-19 pandemic. So this happens when someone puts the pros and cons on a scale to make a decision. So the first quote I have, participant says, so it just depends on who I'm going to be around. My decision is based off them. And then the second quote talks about how the participant is gauging when to go to the gym. So she talks about, should I go at 5 or should I go at 7 a.m.? So this is just an example of that decisional balance and how it relates to making decisions about the COVID-19 pandemic and health decisions to prevent the disease spread. And the final general theme that I found was this concern for health literacy. So I define this as the general need to use simplified information for COVID-19 communication. So this is also connected to the more general definition of health literacy, which is one's capacity to obtain health information to make sound medical decisions. So in the first example quote that I have, you see that the participant's kind of expressing that the sentence is not clear. In this situation, I presented an example sentence from the CDC that I pulled, and I asked participants to gauge what they thought. And so this first participant thought that the sentence itself was not very clear, right? So what are droplets? What are sneezes? And there's this general concern, well, not everybody has the same health literacy, so things need to be simplified. And then the second participant expressed the same thing, that communication needs to be simplified with pictures, images, and things that are just very clear for folks to understand. So as the general implications for future research, there are obviously missed opportunities to intervene. So participants expressed that social media was not being used as it should be. Participants said that future health interventions should convey the importance and associated risks. Communication needs to be consistent and come from the top down. So what is our leadership telling us? Also, communication needs to address health literacy since education is a privilege and not all people have the same access and understanding of information. And finally, what I thought was the most interesting thing is that folks need to have this desire to learn and educate oneself. That's important for disease prevention and communication. If folks don't want to access and learn that information, then they won't learn. And that's it. Thank you for listening to my presentation, and please let me know if you have any questions. Thank you.